Hey everyone, it's Dr. Baird here. Today we're talking about the top 3 arthritis and joint pain myths that keep people in more pain, lead to higher costs, and most importantly, lead to a life limited by arthritis and joint pain, which is something that nobody wants. So here in the clinic, arthritis is, again, we treat people kind of 40 plus. Arthritis is one of the main concerns or questions that we get here in the clinic. People kind of start to wake up a little bit stiff. They start to feel maybe a little bit older than they should. Maybe it's not physically limiting yet, but it starts to get in the back of the mind. Hey, what happens in 5, 10, 15 years if this joint pain were to get worse? And so again, we've talked to people about these concerns, and there's a lot of misconceptions or false beliefs, usually propagated by another doctor somewhere along the way, or a family or well-intentioned family or friend kind of giving advice that leads to these just misconceptions that again lead to not as good results and lead to people making maybe not the best decision about what to do for their arthritis pain. And that's what we want to help correct. We want to help people make better decisions about what to do with their arthritis pain. So the very first one is that a lot of people think that arthritis is the cause of their pain. They went to their doctor showed them an x-ray, said, hey, look there's a little bit of arthritis here, and that's the reason that your knee hurts, or that's the reason that your back hurts. And the dangerous thing is they then use that as a justification for more serious measures like injections or surgeries, again, all while leaving out the kind of long-term consequences of a lot of this stuff. And so what we need to understand is that arthritis isn't the cause of your pain. Arthritis is a normal part of the aging process. There have been multiple studies done that people in their 20s, 30s is when it starts to show up a lot more frequently. I think it's like 35% of people in their 30s have some form of degeneration in their spine that aren't in pain. So that's kind of what these studies looked like. And what they found is that there's plenty of people who have arthritis, aren't in pain, and there's plenty of people who are in pain and don't have arthritis. The two, there's not that kind of correlative factor. And it's important to understand because you don't want to be kind of convinced that you need a surgery or an injection just because of an image, an x-ray. And that happens a lot more frequently than it should. Again, the decision to get an injection or a surgery should be based a lot less on an image alone. It should never be based on just the image alone. So that is myth number 1. The second myth that we hear all the time is that it runs in the family. Well, my mom had arthritis, my grandma had arthritis, and so I'm just worried that I'm going to have arthritis. And so what we need to understand is that, again, arthritis, any doctor is going to tell you arthritis, and we're talking osteoarthritis. There are multiple types of arthritis out there. We're talking about osteoarthritis, that degeneration that shows up on an x-ray, is the result of too much wear and tear on your joints over time. So again, there's not a genetic component to it. This is a lifestyle thing. And why this is important is because a lot of times when people think it's just genetic, they just think, well, there's nothing that I can do. It's genetic. My mom had it, my dad had it. When in reality, and so the result is they don't do anything. And that, again, over time, this is something that gets worse over time. The only certainty here is that the longer you take to decrease that wear and tear on your joints, the worse the pain is going to get. And when you do finally decide you want to fix it, the longer it's going to take to fix. So again, osteoarthritis, degeneration, not something that runs in the family. It is a lifestyle thing. And that kind of leads us into our third one, where a lot of people think, well, there's nothing that they can do besides pills, injections, surgeries, or the other advice is, you just have to stop doing the thing that aggravates it. So if you're a runner, just stop running and the pain will go away, which again, nobody wants to be limited for their entire life. And so the truth is, because this is a wear and tear issue, there's plenty that you can do to limit the wear and tear on your joints. That's what's always so surprising to me in the medical community is, again, any doctor is going to tell you osteoarthritis is caused by too much wear and tear at the joint. So why is there so little attention paid to how to limit the wear and tear on our joints? injections don't do it, pills don't do it, rest doesn't do it. Well, rest technically does it, but again, then you're just resting and not doing the things that you want to do. And again, surgery kind of does it, but again, once you start going the surgery route without correcting the underlying causes, it's going to lead to another surgery. And so yeah, I mean, what you really need to focus on is how do we limit the wear and tear on joints? That's through movement training, and that is through strength training, the two most important things that you can do right now to limit the wear and tear on your joints and be sure that this doesn't get worse and become a major problem 5, 10, 15 years down the line. So there you have it. Those are the 3 most common myths. Arthritis, not the cause of your pain. It doesn't run in the family, and there is actually plenty that you can do besides just resting, pills, injections, and surgery. So that's all I have for you today. If you have more questions about your arthritis, head to the website down below. Plenty of free materials, plenty of free articles that I have written. If you do have any questions, feel free to leave a comment below and I'll answer them as best I can. Thanks.